it will have enormous implications for how a young person functions day to day. If there's any one deficit in any areas of their developmental domains, it will likely have an impact on how they form relationships with people, how they manage situations they face, such as going to school, dealing with unexpected situations, dealing with frustrations. So it's really quite critical to have a deeper understanding of where the child stands in a developmental context, to give us a foundational understanding of what could be contributing to their maladaptive behaviour for which they are coming to us to receive support for. It's as critical to collect developmental history and developmental information about the child or young person as what it would be about to collect information about their family system, such as when we, draw a genogram. We need to understand this child's intellectual abilities, social skills, communication skills, physical skills, and emotional development in order to put into context what we're seeing in front of us, the behaviour of concern. Without that information, we're neglecting a huge piece of the puzzle. We do understand that mental health concerns can occur out of family dysfunction, difficulties at school, sometimes even biochemical imbalances, various reasons, but we would be neglecting a huge piece of the puzzle if we were neglecting sensory impairments, communication impairments. We certainly don't neglect trauma, and that's a disruption to emotional development, and we also know from research it can also affect intellectual capacity as well. So we really need to make sure we cover all domains of development when we're doing our assessment. So collecting information on all aspects of their developmental functioning and taking a really good developmental history is as important as doing a family genogram. I would more likely talk to caregivers, especially for the really early side. So if there is a suspicion, and usually when a family comes to you or a young person comes to you, there might be some obvious markers that this person might not be communicating in an age-appropriate way, or potentially they're demonstrating concrete thinking processes, or things that might kind of lead to question marks about where they stand. So you might want to go back and take a history from parents. I mean, as a psychologist, it's of interest to us to take it as far back as were there any complications in pregnancy or in delivery or post birth. To understand if there were anything that could have impacted the brain, lack of oxygen, things like that. Because as we know, even kids that have, that are premature, they're more likely to have some developmental challenges. So taking it back as far as that to really catch the critical points. Milestones, again, parents will know that a lot more than kids would know, so that's important. When did they first walk? When did they first talk? And just kind of ticking off that these they met the appropriate milestones. If they had not, then we might ask why that is, and did they actually access any supports. Sometimes people come to us way down the track, but they neglect to tell us actually in their earlier years they required speech and language support, and that's really important knowledge for us. One, it gives us an understanding maybe that if it's about their receptive language, that maybe that they have difficulties in understanding what people are telling them, what they've been instructed, what's going on in the world around them. And that could also contribute to our formulation about what's happening for them currently. What we also know is that when someone has a delay or a deficit in one aspect of their development, they're also probably likely going to have a delay in another domain. So it really provides an avenue for exploration. So if there is a question about whether the child is displaying age-appropriate functional skills in any one of the developmental domains, good information to collect would be to speak to their teachers, because often teachers have a really good sense of where the child stands in respect to their peers. Also, seeking consultation from your colleagues in your team that have an understanding about development or are able to administer adaptive behaviour assessments or provide some guidance around it. That could be useful as well to get a sense of if what you are seeing is a function of development rather than other factors which contribute to mental health or behavioural concerns. Within CAMS, we are likely as well to see a lot of children or young people that come to us with a diagnosis already known, be that an intellectual disability or autism spectrum disorder or another childhood neurodevelopmental disorder or ADHD, for instance. And we will be asked to address their behaviours of concern, whether it be aggressive behaviour towards others, self-injurious behaviour, for example, head banging or pinching themselves. And we will be consulted around how to support not just the young person in their home environments or school environments, but how to provide advice and understanding to parents who need to lend support to these young people. The key point of when you have a child or young person that has a known disability and presenting with a mental health or emotional behavioural concern is that once you have collected the information about their developmental functioning and probably doing a really good analysis of what are the challenging behaviours of concern, and we would call that a functional analysis of behaviour. So really kind of taking it down to how long has the behaviour been present, when is it most likely to occur, when is it less likely to occur, and with that comes clues as to the function of that behaviour. And generally there seems to be, probably about, 5 to 6 reasons why certain behaviours might occur. And it could be due to a deficit of functioning, whether it be intellectual or whether it be emotional or social skills. So that creates, I guess, a target for intervention. It could also be about connection or seeking. So, the old-fashioned, he's attention seeking, but it could be that they're seeking connection. This is their way to draw people in. Or it could also be a function of where they stand emotionally. This is how they express their frustration. They've got no other either expressive means or ability to let people know that they're needing assistance with what's going on or to be able to self-regulate. So this is the way that they manage their emotions. It could also be for want of an item. So some kids who might be, for example, non-verbal, have really poor expressive communication. This can be a way for them to communicate that they are in desire of something. So we really need to take, a thorough analysis because that will ideally highlight where is the target for intervention. Is it about increasing their communication skill? Is it about increasing the opportunities for connection and quality time between the child and their caregivers? Without that, thorough analysis of the behaviour, we wouldn't really be able to, target the right spot. So the same way that we would consider, intellectual disability and autism spectrum disorder and understanding what deficits or impacts that has on certain developmental domains such as communication skills and social skills. We should also acknowledge that there are a lot of kids that might also have comorbid physical disabilities, which could be subsequent to a medical condition that they have. Probably would need to reflect on, what is the day-to-day, treatment or maintenance or intervention for that physical condition or disability. What impact does that have for the child? Is it disruptive to their day? What impact would it have on a carer having to tend to that child's physical needs or medical needs? Thinking about, the interplay, a child with, some type of intellectual disability coinciding with physical deficits such as not being able to walk or having complications with breathing or swallowing. All of these things, I guess, add up to disruptions to their day, impact on emotional functioning, because obviously it would take a toll on their tolerance. It creates frustration. So managing a lot of these deficits or the implications of what would occur is critically important to supporting optimum well-being for these children. Creating, I guess, an understanding for parents and also schools about the implications of that is also a major role that we can play too. Sometimes it is just about promoting awareness or understanding about the child that can make people in their system may alter their expectations or make accommodations or adaptations for them so that that child can function better in their environments. We need to make sure that we are not culturally biased in our assessments or in our interventions with families. We will come across families from diverse backgrounds. It will have an impact, I guess, sometimes on the information you can collect. Sometimes some things aren't as salient in their mind or memories than what it is in ours. For them as well, they might see that it's not so critically important that a child display a skill by a certain age, or they might have, I guess, priority or emphasis on other certain skills and in their development than what we might in a mainstream Anglo-Australian culture. What's important is that we do everything in context. So always understanding a family, understanding the context they're living in, and asking them what they think is important about, where they think their child should stand. We need to be respectful to their culture, and we need to ultimately focus on the child and think what skills do they need to function better in their environments. So we can't make those decisions without consulting with the family and being considerate of their culture. But ultimately our role is to assist the child to achieve optimum well-being across environments. One thing that we might get consulted or asked to do in CAMS is to develop what's called a positive behaviour support plan. The idea of it is to have a list of strategies that work towards reducing problematic behaviours or things that are causing disruption or to the child or within their environment, or any types of maladaptive behaviours, and also to promote pro-social behaviours or optimum functioning. It's a program or a model that has emphasis on proactive strategies foremost, but we also must have some reactive strategies. Essentially, that means the reactive is dealing with the behaviours in the moment. What do we need to do in the time to, for example, de-escalate a child who's quite highly aroused, might be displaying aggressive behaviour either towards themselves, self-injurious behaviour, or aggressive behaviour towards others. It's important to work with a family to develop these strategies of what to do, how to manage it in the moment. And it could be about identifying what the triggers are and helping the family to come up with a list of ideas of how to intervene early, and then having a list of strategies to address the peak crisis moments, because they are still going to come, and we need to help families be able to deal with those moments. When a child is actually functioning at equilibrium, they're not in crisis mode, they're not escalating, they're the times that we would consider putting in other strategies that can promote pro-social behaviour. The pro-social behaviours would be, I guess, what we would consider as being adaptive behaviours, coping well within their environments, demonstrating reasonable level of emotional regulation skills, social skills, and being able to function well within their environment. A family would benefit from some proactive strategies on how to promote maladaptive behaviours. That could be some targeted skill development training. Do they need to have some specific social skills training, speech and language communication training? Could it be as well that they might benefit from some visual social stories where we explain directly how to manage a particular situation? For example, how to initiate a conversation with someone in the schoolyard. And also the broader systemic issues would need to be addressed as part of a proactive strategy. So if the behaviour is driven by connection seeking, then a good intervention strategy would be to have regular periods in the day or the week where a child is spending good quality time with their family, with the understanding that if they were getting their connection needs met through good positive experiences, they might not need to rely on maladaptive behaviour to draw their parents in.